can tell you as a dermatologist, I can tell which of my patients have been using or taking hormone replacement. The skin quality is so much better. What happens through perimenopause and postmenopause is that your skin gets thinner. That's why we get vaginal dryness and your mucosa gets thinner. So we try all these things. You can use retinol, you can do lasers, you can do fillers, you can do all this stuff, have a facelift. But if your skin quality isn't good, you end up looking filled out or pulled, but not more youthful, not even younger, just basically done. It's not a good look on anybody. So as we get older, there's a certain amount of acceptance because your skeleton is changing. Even with hormone replacement, I learned like, oh wait, no, you still do get older. It doesn't turn it off. It just slows it down a lot and makes, so that's where longevity beauty comes into play. And I think that there are really great things like rapamycin, metformin, other things that are going to really change the aging process. And that's a lot of what I do. But even if you just look at doing hormone replacement plus these treatments and accepting that your skeleton is changing, all the layers of your skin are changing, and your bones, your ligaments, your muscle, the fat, the layers of the skin age at different rates. There's no way at 50 you're going to look 20. And I actually think 50 is the worst decade because 50 is when you start actually feeling like you look older. And I asked plastic surgeons, like, what is the best age to have a facelift? And they said, when you think you look like you're 53. But what's great about 60 is that at 60, you realize you are aging and there's a certain amount of acceptance that comes with it. And then you start to see your beauty. Then you start to look in the mirror and go, oh wait, I have these great features. I can look balanced. And you stop trying to think of yourself as beauty in terms of fertility. Because so much of what we think about beauty is about the idea that you're fertile. And that's hardwired into our DNA. And the other thing that's hardwired into our DNA is looking for problems.